Hello, and welcome to the Prescribing the Future podcast, where we explore how technology is transforming the way care is delivered. I'm your host, Dr. Jean-Luc J.L. Neptune, and I'm the clinical commercial leader at Commure. Today, I'm joined by Dr. Robert Biernbaum, Chief Medical Officer at WellNow Urgent Care. Rob, if you'd like to introduce yourself, that would be great.
Sure. Hi, everybody. I'm Rob Biernbaum. I'm our Chief Medical Officer here at WellNow Urgent Care. Been with the company about 5 years. Prior to joining the private side of healthcare, I worked for non-for-profits for 25 years. So it's been a great journey, and especially the journey of watching how technology in healthcare is semi-catching up to all the other industries. But it's been an amazing journey.
Sounds good. Yes, and it's taken quite some time. I've been doing this for a long time, and it still amazes me how much we lag other industries. But maybe the best place to start is why don't you tell us a little bit more about WellNow Urgent Care? What kind of organization is it? The community you serve, and maybe the challenges that you were facing that got us talking, and was the beginning of our relationship.
Sure. So we are a multi-state urgent care company. We are in 5 states. New York, Pennsylvania, Michigan, Indiana, and Illinois. We serve kind of all realms of communities from rural to suburban to urban. We are an urgent care that takes all insurances. So we take Medicaid, we take all commercial plans, Medicare, really want to be there for our communities to ensure that when we're needed, that we're open. We've been around since 2012. I've had name changes and significant growth over the past number of years, but we are kind of the typical urgent care where we generally are doing acute care. We don't really do primary care. One issue that we've always had is we want our providers to practice to the top of their license. And everyone talks about this, but when electronic health records came out, providers were pushed behind computers. And it was definitely better in terms of data to have electronic health records, to be able to gather data, look at trends, make, with the data, make some predictive analytics to really improve care overall. And by the way, you couldn't read our handwriting anyway, so electronic health records are great. But what I think has happened over the number of years is providers have just gotten kind of numb to the clicking. And all they're doing all day long is clicking or typing. And I'm old enough to remember physicians who retired because of all of this. So for us, we started our journey years ago. We had in-person scribes. And often they were, young individuals who wanted to go into some sort of medical career, whether it was medical school, PA school, NP school, and they would go into rooms with our providers, which worked great, with a couple exceptions. They always left us. The best ones got into those schools, and they always left us. And so we started our journey looking at Ambient Scribe to replace our in-person scribes because we just couldn't keep up a number of years ago. And I think we were an early adopter. And back when we started, there weren't a lot of companies out there. We after kind of some tough learning lessons, we found a great partner in Commure, and our medical staff, I like to brag that more than 90% of our notes are done using an ambient listening with Commure, which has some great AI intelligence. And it's really changed the game from a provider happiness and efficiency standpoint in our company.
Sounds good. And you mentioned a couple of things there. So first, you talk about top of license. I've always argued that the EMR forces providers to operate at the bottom of their license, basically turns them into data entry freaks, and that's all they end up doing is typing and adding information into the EMR. That's often, there's a lot of EMR bloat as well, right? There's a lot of data bloat from copy and pasting. So I definitely hear that. And it's funny, when I did my training, the organization where I trained, we were just at the cusp of starting to use the electronic medical record. We used to use it for like discharge summaries. So
Mhm.
a patient would be discharged, you'd dictate the discharge summary, and then that would be the electronic medical record. But in terms of like regular progress notes, that was implemented actually after I finished my training. So it's not that long ago.
Yeah, no, me too. I'm an emergency medicine doc, and by trade, ERs were early adopters to technology and healthcare. I always say we're kind of the nerdy bunch of physicians, and I went through numerous different electronic medical records, all of which for ER docs made us slower. And if it wasn't slower, we would often just forget because when you're seeing a lot of patients, we would forget what was going on, and so our charts sometimes had bloat in the wrong areas, right? Too much information from previous visits or other visits, in an organization, and not enough information in others because we couldn't remember what the patient told us.
Yep.
And that I always say, when I started my career, we dictated everything in the ER. So I was used to walking out of a room, grabbing, I'm actually going to say dictaphone because I can't believe I'm that old, but yes. So a dictaphone and dictating, and I could do that really fast. And if I did it as soon as I left the room, those charts were pretty good. Unfortunately, that's back when people somewhere were typing them and it took days for those charts to come back, and sometimes we spoke too fast and you really couldn't get any data out of it. And so, I think we brought on EMRs because of our inability to truly as medical staff create charts that were worthwhile. So that's what to me brought on the movement. I'm pretty techy, but I will say for us having an AI ambient listening tool, it is a complete game changer. Because, not only when I read charts and I'm doing quality reviews, I can make sense of what happened. And I think that's a big deal because I can support the medical staff if there's outcomes that went in a way that we didn't expect, because that information is there. But the other big thing for us is by not doing anything else, not like the urgent care patients have changed, our acuity is increased. And our acuity is increased. If you think about, let's go back to when we were documenting on pen and paper or dictating. Even dictating, I could walk out of a room and I feel like my memory is pretty good, but I was going to lose 25% because you know what? There's a lot going on, and me losing that 25% does a couple things. My HPI, it just isn't as good as it should be when you have something listening. Secondly, my medical decision making was never good. I mean, I will openly admit an EMR is not good, dictating not good. With an eminent listening device and with us having the ability to have, templated rules, our medical decision making is everything that went into a provider's brain that they're never going to be able to type or just completely say out loud. It just challenges the provider as well to also make sure they're not missing anything. That's my favorite thing about it as well. And we all know, listen, higher acuity, which is what we were always doing. We just weren't getting paid for it, right? Higher acuity brings about higher revenue because medicine is still based on our E&M levels, and E&M levels are all paid at different amounts based on the acuity of the patient. So we're finally, in my opinion, seeing the real acuity of what we've been doing now for years.
Yeah, and people always are concerned about AIs hallucinating. But going back to what you were saying before, I always say doctors hallucinate as well. I mean, we misremember things, we miss details. So having the ambient scribing, listening to the whole discussion, I think is really useful and allows you to capture depth that sometimes you would just miss because you're running between so many different patients. Particularly if you're in an ED or if you're like in a peds practice and you're seeing lots of patients all at the same time, and all those patients start looking the same after a while. Going back to the E&M coding, I mean, can you give us an idea? I mean, I've always been under the impression that there is a lot of leverage from E&M capturing the right E&M codes, like a tenth of a percent of an E&M increase can be like $500,000, $1 million more in revenue.
Yeah.
Is that your understanding?
No, it's definitely true. And you think about urgent care where, you know, thankfully, obviously, our patients aren't as sick as they are in the ER, but in urgent care in 12 hours, seeing in the high 40s, low 50s is commonplace. That's a
Hmm.
lot of patients per hour. And it does, having this type of, ambient listening that has intelligence to it, it makes it so that the providers aren't dreading coming up with everything they need to come up with. And the beautiful thing about it, and what I love the most about this is, from a medical decision making standpoint, I know when I look at a sore throat in my brain, I'm already ruling out the scary stuff. This isn't Ludwig's angina. It's not a retropharyngeal abscess. And I know that, and I've already said it out loud because my physical exam doesn't support those things. And it's smart enough to know that when I build my templates to include those things, but also know that the physical exam doesn't support that. And it actually puts that in my note. So when you think about this acuity change, small amounts of change, so we're talking like 0.05 change is a significant increase in terms of value, like you said. When you're moving from a 3.5 to a 3.6 to a 3.7, those are multitudes of revenue that we deserved from the beginning. We just weren't getting that amount of money because we couldn't code at that level because we missed everything. Because if you think about it, what I just said, the retropharyngeal abscess, Ludwig's angina, did I put those in my chart in the past? No, because I would have actually had to either type it or find it somewhere in my EMR to click it, or even in Dragon, remember to say, my differential diagnosis included the following. And I think the nice thing about having an ambient device, you can train them and they're individualized by a provider. And I think that's the thing that people don't realize. Everyone's like, everything's going to be a canned note. I'm like, no, our note differentiation today on Commure is a million times better than it was in the EMR, and way more than that even when we were pen and paper or dictating, because we said the same things over and over again.
Yeah.
Because our brain, when we used to dictate, I would dictate a chest pain chart with the exception of symptoms, and it pretty much read the same as most chest pain charts because my muscle memory to dictate a chest pain chart was my muscle memory. But humans are different, and they tell a different story, and our physical exams are different, and our testing results are different, and that allows us to be able to produce charts that are so distinctly individualized for each patient. It produces such a better record from a quality, from a financial standpoint. It's, you realize you don't want to be embarrassed when someone later reads your chart. And all of us, that was always your fear, right? Like, oh my gosh, I'm going to get sued, someone's going to read my chart on the stand. And like, I spent all of my time clicking. The reality is those charts looked so canned. And I think what's great about Commure and ambient AI is that everything is so individualized by patient.
It's great, and the way you'll hear people complain that these technologies are being used primarily for upcoding, but I always say it's like appropriate coding, capturing the real value of the work that you're doing and getting paid for it. So it's good to hear that. So we talked about E&M acuity. How about any other benefits? I think we had talked a little bit about sort of how length of stay may be changing, how staff morale is changing. So let's talk about a couple of those.
So I think, burnout's a real thing in medicine, and thankfully I always say in my career, and I'm sure yours, we weren't allowed to talk about that. Like, hey, listen, when you and I trained,
Definitely not.
it was, thank you so much for letting me work the additional 18 hours today. I appreciate it. But burnout is real. And if we want to have people continuing to practice medicine, we need to ensure to do things to lighten their administrative burden. Because we all love taking care of patients, or we wouldn't have gone into this. Like, you put me in a room to take care of a patient, I think it's such an honor and a privilege. Clicking and typing is not an honor or a privilege. And in fact, that's what led to a lot of burnout. There have been studies that showed that the advent of electronic health records really kind of swung burnout in a bad direction. I think by having something like Commure, that's flipping this. I will openly say our medical staff, I think that we're blessed because our medical staff really is tech savvy. And they were anxious because we were on a different product before we switched to Commure. And let me tell you, I was pretty anxious about that switch. Our medical staff, they have openly said, if we take this away, this would probably, a lot of them would say they would quit. People are leaving on time. And that's a big deal. People are not bringing their work home. Doing your charts at home, which was our existence literally forever, doing your charts at home leads to burnout. It leads to time away from your family. Your personal time is shot. Getting to the end of a shift and in urgent care, seeing 45 to 50 people in a 12-hour shift and realizing that your notes are done is an amazing feeling. To me, that is the number one reason that I hear from physicians who are my age who are deciding to step away. It isn't the medicine. It's the other stuff on top of the medicine. And this is one area where this type of solution just takes that away. And so I think it's decreasing burnout. I'm excited because I always worry about generational medicine. The people who trained me, a lot of them are retiring, if not retired. My generation of medicine, of physicians are retiring. And I worry what's going to happen generationally. And I think when we're really starting to look at AI tools and ambient listening, this is the next phase of everything we do to make our job easier so that we can practice. And so I think there's that. I also think it makes everyone faster. When you know that your note is being taken care of and you just have to review it and maybe edit a tiny bit, patients go through faster. Because I know a lot of medical staff members, they don't want to forget things, so they're charting and they're not getting patients out the door. And urgent care is supposed to be urgent, right? Like that's by the definition of what we're trying to sell here. And if patients are waiting because you're clicking or even dictating, I think that is a waste of time. So we see that our length of stay has improved as well.
Got it. And what's the significance of length of stay from an ER perspective? I think that you're trying to minimize that.
Yeah, I think length of stay for both ER and urgent care. So first of all, no one wants to come to either. All kidding aside, nobody wants to be in an urgent care. Nobody wants to be in the emergency department. They're chaotic, both of them. For urgent care, for us, we know that people tolerate under 60 minutes. That's kind of where that magic line is. Post 60 minutes, it feels long. And if it feels long, the chance of them coming back decreases, right? And, we are both a healthcare and a customer service business. There are other urgent cares. We want to be better than everyone else. And I truly think that we are. Part of that is we want to ensure that our length of stay is under that kind of magic number and even lower, because we want people to feel like that experience that they got to spend time with a provider who wasn't staring at a computer. They got to get all their questions answered, and they're in and out within an hour. And I think from a customer service standpoint, that also improves the quality of care. The better the experience, and there's studies on this in urgent care medicine and emergency medicine, the better someone's experience, the higher likelihood to trust what you told them during that experience.
100% agreed.
And so to me, that lower length of stay improves we track something called NPS, which is basically customer service data. It improves and elevates your NPS, and therefore that trust, wanting to come back, have that, if something happens in the future, be able to trust that urgent care location, to me is critically important for the betterment of that person's healthcare.
Got it. And what are your MPS numbers ballpark at WellNow?
So we're in the high 70s.
Right.
We
For
are,
health
yeah,
for healthcare, that's amazing.
yeah, we're pretty proud of ourselves. We really believe, I would say the minimum requirement is to practice excellent medicine. That to me is a minimum requirement. But we also believe that, these are our customers as well. And they should have a great experience. They are, as I said, no one wants to come to an urgent care. They're hurt, injured, not feeling well. You want to make sure that that experience from the time they walk through the door to the time they leave is met with kindness and empathy and smiles. And because if we're always practicing it at excellent levels across the country, and I know that that's not true, but let's just say that's the minimum, that customer service to make someone feel good about their visit is critical to healthcare. So we set very high targets, and I'm proud to say that we are in the upper 70s, at almost all of our sites. So
Great. And I continue to say, and I've beat this drum for a long time, I really believe that ambient scribing is the first true breakthrough technology in the let's say the internet age, because it does what technologies do, right? It makes things cheaper, better, faster. So again, providers able to do their charting faster. The patients are happier. You're getting paid more. Like that's what technology does. And I continue to believe that we're still very early in this technology. Remember, ChatGPT launches November 30th, 2022. So we're not even 4 years into this AI journey. And in terms of, using these technologies, it's still been only a year, 2 years of experience. And, if you think about how much we learned in using EMRs over 20 years, where will we be in 20 years of using AI? So I still think it's very early, like bottom of the first in terms of, where we are in terms of using AI technology.
Oh no, I completely agree. I mean, I think you look at where radiology is, right? So we know that AI is now involved and approved through the FDA for reading certain X-rays. And keep in mind, to your point, this is all new, right? So where is it going to be in 5 years? I think the amount of improved clinical decision support that support our medical staff, I think imaging is going to be a massive step in the right direction. We as medical staff, members, we know what we know, but having something there as something to bounce it off of, and that is another aspect of Commuter that I do love. It actually has that feature where sometimes it's been a long day and you just don't want to look something up and you just want to be able to type it in and get that answer. The value of that is huge. And I always say, we can't know everything. As physicians, PAs and NPs, we have a limited amount of brain room, and we all look things up. And sometimes we look things up because we just want to make sure that we're right. And so I think, to me, that's one of the biggest areas for AI and healthcare that's going to change is the ability to have clinical decision support in the moment with AI.
So totally agreed. And it's interesting. There have been a whole bunch of studies in the New England Journal and JAMA. There was a JAMA article this week that mentioned that demonstrated that the time saving in the chart is modest. Like I think the stat was like 15 minutes of chart savings time per week, and a modest increase in patient throughput, like half a visit per week. And part of my argument has been that it's early for sure. Well, number one, I think we still have a lot to learn. But I think the other thing too is that we still haven't fully hooked up ambient upstream and downstream, because what I continue to believe is, let's say we have technology that's able to do like a history and save the doc some time on the history and then connect that into the ambient, and then on the back end connect what the provider was saying to orders, let's say. Now you really start to hook up and drive efficiency there. Do you agree with that statement?
Yeah, I think if you think about, part of the reason, and I'll use, Epic, why it works so well is because everything is hooked in, right? So the person comes into the emergency department, I may already have their medications. The issue is not everybody is on those records, right? And, urgent care, we're kind of disparate in terms of what we're on. We're not generally connected to a lot of things. To me, also, what AI can do is be able to go into an HIE and pull the appropriate summary and tee that up for me. That to
Yeah.
me is such a, if you can imagine, I'm registering before I've even walked into the room. I get, hey, this is Rob Biernbaum. This is how old he is. He's on these current medications for these following problems. He's presenting today with shortness of breath.
That's so powerful.
It's just massive.
Yeah.
And while patients are waiting, having AI interact with them to get the history to save me time. I'm going to review it anyway. But AI is as intelligent as I am in getting a history. It understands nuance. And, rule sets are important when it comes to AI, and then it learns rule sets. That time saving, also it's value add for the patient. Because you always think time waiting isn't value add. It is if the patient is doing something to assist in their healthcare. And I think these are early things that I know that AI is already looking at from a healthcare standpoint. And I think it's honestly just the beginning. I am excited to see the remainder of my career where it lands. I don't know what I would do with it even outside of healthcare. I use it in my personal life, AI, constantly.
Me too.
Yep. So I think in healthcare, since we've lagged behind everything, I always have said, before a patient portal, I had a banking portal for years, and that was banking. Before we had all of those things in healthcare, they've existed in other industries. I just think that healthcare is finally catching up. And I do think one of the biggest differences with AI is it may shoot us forward beyond other industries because of how much passion now we have around just this. To your point, I would say the last year. I think this has been 12 months of just exponential growth. And I know with Commure, we're partnering on some really strong clinical decision support based on what's being said in a room and what to recommend. That also saves time.
For sure, absolutely, and we'll get back to that again because I think that's an interesting area. From what I know about WellNow, you as an organization have moved very quickly. I think if I remember correctly, it's like 600 providers onboarded in less than a year. One of my teammates was telling me that you guys have already done 1 million scribes, which is a crazy big number, and that you're doing something like 90% of all notes are being done with the ambient scribing. But with the caveat that you guys are actually doing this in an unintegrated fashion. You are copy pasting and still driving all these improvements in efficiency. Can you elaborate on that?
Yeah. So, for us, thankfully we had scribes before in person, and then we did go to the first version of Ambient before we came on Commure. So when we launched, people had already seen the benefit and the time savings, and then the note output that Commure was able to produce for us was phenomenal. People got really used to it fast. I mean, to your point, we have 600 medical staff members, and we're 90+% it being used. And keep in mind, there are some things we can't use it for. So We can't use it for complex yet. I always will say yet. We can't use it for complex occupational medicine physicals, right? So I'm doing an asbestos physical or a DOT. We can't really use it for that. It just doesn't. It doesn't integrate into what we're using. But the team is so vested into what they're doing. Yeah, it is a non-integrated into our EMR. At the end of the visit, the medical staff member is going into Commure, making sure it reads all the way, making edits, talking to it so that it produces the final note, and then they are copying and pasting it into a section into our EMR. And they've asked, hey, will there be integration? For right now, there isn't going to be, and they don't really ask much anymore because they are just fond of what we're doing. Yeah, We in a very short period of time got way higher percentages of our medical staff using this. We
Got it.
also were so dedicated to this. We used to have Dragon,
Hmm.
and we got rid of Dragon. We found it to be duplicative. If you want to dictate, you can dictate in Cumure, and so we got rid of it. And I think a lot of places kind of send a bad message when it comes to this. They'll allow you to keep having Dragon. They'll have ton of different ways to do the same thing. And for us, we put all of our energy behind educating the use of Cumure because we saw the value in this, across everything that we've talked about. So we talk about it constantly. We talk about how to make it easier, how to make it better, all the things that are coming. So our medical staff is just vested into what we're doing here.
That's great. And again, just a testament to how powerful the technology is that even in an unintegrated fashion, you're getting all these benefits. But it does beg the question, why isn't integrated? And I think, you were alluding to it there. I think the answer is because the EMR vendor doesn't want it, right? Is that pretty much it?
Yeah, I think, EMRs, a lot of them will see this type of technology from private companies as a threat. And I don't completely understand it. I work really well with our EMR vendor. I think part of it is a lot of EMR vendors want to be everything for their customers, and I think that's amazing. Like I love that. I also think there's only a limited amount of time for programming and stabilization, within technology, where there's always going to be vendors who are, top of the line vendors where, not every EMR is going to put this much money and energy into, artificial intelligence. So I think that's where we see a lot of EMR vendors who don't want, huge integration with other companies.
Yeah. I mean, I've always argued that, most EMR companies are, just trying to keep their technology working and, supporting the customers that they're supporting, and that they generally don't have the resources to really be on the cutting edge of AI. And, if you were to look at Cumure, I was just at our headquarters last week. I mean, there are just hundreds of engineers working on this technology, just on the Ambient alone, dozens and dozens of engineers, whole teams working on building the features, and as you certainly know, in an urgent care environment, there is so much that you have to build for, so many edge cases and corner cases, and I just think that a lot of, we see this from a lot of EMR vendors. They're like, we're going to offer the, 6 months from now, we're going to have a great solution, but I think companies like ours and this new generation of AI companies will always be ahead. And I think that a lot of EMR companies are going to have to say, hey, we should partner, and we should find best-in-class partners to help us deliver a best-in-class service to our customers.
No, I agree. I think it's, it's super difficult in technology to be amazing at everything. And, we have a great relationship with our EMR vendor. But it is impossible to be best in class across the board in every single thing that is expected in healthcare. You just can't be. And, niche software companies, I think this is a space where they're willing to put all of their R&D and dollars into something, whereas EMR vendors have to spread that out. I mean, they have to deal with, from, scheduling online all the way through getting paid by, in a, multitude of insurers. That is a lot to manage. And whereas, companies like Cumure, they're really worried about one thing. I mean, they have multiple divisions, but when it comes to Ambient, they're worried about Ambient and improving it.
Absolutely,
So,
absolutely.
yeah.
And in terms of the rollout, what were the factors? What would you identify as key factors to making this rollout work and getting you to the point where basically you're scribing everything you can be scribing?
So I think we're big into piloting. I think piloting is something in medicine we don't do enough of. So we wanted to get people who are going to give us like tough feedback in our pilot program. And we picked people who were already using a previous vendor who loved that vendor, which is not always a smart thing to do, right? Because they loved the vendor, and we were like, hey, why don't you look at somebody else? They weren't too keen on it. And so I think for us, having a pilot program, really listening to our medical staff on what works, what doesn't work, and then I think a lot of the way medical providers think, they have to trust that the company that they work for has the best interest in them and the patient. And we were able to, with Kimura's help, really have a ton of training sessions, really teach people how to do rule sets, give people the flexibility to use this, that I will openly say, we are also shocked that we are where we are. I think it's awesome. The team that helped bring this about has done way better than I expected. Both through our medical education and partnership with Kimura. I'm always shocked at our numbers and how many scribes we do every single day, and the percent of the medical staff that is where they are. It is shocking, because I hear stories from other healthcare organizations who are excited to be at 60%. I would not be excited to be at 60%. So, because that would mean that 40% of our notes are probably not that great.
Sure. No, and look, I think that's the goal, right? Is to figure out how to drive functionality, features of the technology, so that you can support 100% and you can be 100% efficient. What was I going to say? For us, I've been involved in the rollout of our technology for a couple of national provider organizations, and I think the big thing that makes us different, one of the big things that makes us different, is our commitment to the white glove service and to really being on the ground. So, I've been at strip mall clinics in El Paso, Texas, right? In the middle of a dust storm, by the way, San Antonio, and I think it makes a real difference in terms of helping providers get comfortable with the technology. And I think if you're a pure technology company, there is a feeling like, hey, let's use technology to train people and let's take the human beings out of it. But I think that having the white glove service on the ground really, really makes a big difference and is a differentiator for us.
No, completely agree. And I think one of the things that we did that I think helped is we made sure all of our clinical leaders really understood this, were incredibly supportive of it. All of those things, I think, is really one of the most important things you can do, is you get your leaders to trust this. And each of them has an area and a group of medical staff members that they lead. And so, to me, bringing something new into an organization is all about trust. Change is difficult for all of us. But if you trust your regional leader, then you're going to be way more open to actually trying something. And so I think that was the other thing that Kimura did for us, is they spent a lot of time making sure that our leaders understood it really well. And I think that's what pushed us kind of past that 90%.
But I think some other things I'd like to think about are, you talked about things that you'd like to develop, that we're working on developing, and this idea of maybe using the technology to support providers who may have forgotten something. We have a technology called Care Cues that we're using to help people remember things that they may have otherwise forgotten, and doing it so in a very subtle, contextualized kind of way that doesn't create alert fatigue. And maybe you can talk a little bit about that.
So for us, I think we are really specific in terms of our clinical guidelines, and we write them for specific reasons. We, as an urgent care, we're a little different. We have a quality management plan just like hospitals do. We truly believe in, when I say delivering the very best care that we possibly can, we believe in that. We have, our quality scores will drive, I always say, quality scores should drive your triple aim, and ours do, right? So we should make sure that the system that we're working with allows us to get there faster. And so, for example, one of ours is we really are focused on the appropriate use of durable medical equipment. And I will say, listen, I'm old enough to say we actually casted in the emergency department with plaster. I actually remember plaster sinks, right? And then, orthoglass came out, and we were like, what is this amazing stuff, right? And so, little by little, medicine advances, right? And medicine advances to the point where I don't have to build anything anymore. And trying to get people to change, knowing that if I'm using really good durable medical equipment, that's going to support a joint way better than whatever I'm going to be able to build. And by the way, showering is so much easier with durable medical equipment because you can take it off and put it back on. But trying to get that change management effort is difficult for us because we don't like change in healthcare. Listen, I will openly admit, as a physician, we are not always easy to grasp new clinical guidelines because we trust what we already know. And so we're partnering with you all on how do we build that, because knowing that someone's going to need it is already being done by ambient listening. AI already knows that the person's here for an ankle injury. They already know where the tenderness is. They already know that we're telling them that the x-ray is negative. They know where the swelling is. They know the most common ligament that's injured in a sprain. It's just training at what type of DME to use so that we can really push that to ensure that our patients are receiving the very best care, and taking it a step further, having AI understand what ICD-10 codes correlate with it, because you and I both have been through the journey of we were for years allowed to use non-specific codes for whatever we wanted. And that is not the reality in the business of healthcare anymore. We know that payers will deny a non-specific code now. And so that package of bringing that together, that is way too much for a medical staff member to remember. Like, that's a ton to remember. Using AI to recommend the ICD-10 code based on your physical exam and history and all the things that you mentioned, plus recommend a specific type of durable medical equipment, like that is a use case for AI that our brains are not 100% always going to get right.
For sure. And I always argue that no matter how smart you are, I'm sure in your training you met some of the smartest people you've ever met in your life, I still think that so much of what we do in medicine exceeds the cognitive capability of what a human being can do, like in terms of all the things you have to bring together. And I think one of the beauties of the technology is to be able to support us, to be assistive in that, and bringing those things together and helping us make decisions. So not taking humans out of the loop, but providing a scaffolding so that humans can use their judgment to make the right choices for the patient with the right context of all the information that they need to have. I think that's always been very challenging, and I'm excited about the technology and its use for that pattern.
Me too.
Yeah. And just in the last couple of minutes here, I mean, what's your vision? One of my thoughts I've always had is a day where doctors are not even on the computer. I think in the early days of Siri and the voice agents, we were like, oh, doctors are just going to be talking to Siri. But I don't think that ever progressed in the way that we thought it was. And then Google Glass and, had a vision for the future. But I think, as we think where we are now with the ambient scribing and automatic voice recording, I do think we're getting to a point where you may not be required to be on the computer as a provider, and you can sort of just focus on human interaction. Already, we're at a world where now you don't have to peek out from the computer to talk to the patient because the ambient scribing is listening to you. But as we think about orders, as we think about referrals, maybe all of that stuff can be done in an automatic way. Do you believe that that's true, and how long do you think that's going to take?
Well, I think we're going to see it within the next 12 months. I think that the next, you kind of nailed the next couple things for me, which are, there is no reason why I can't say my orders out loud. I think that there will be double check systems, whether that's AI reading it back to you and you agreeing, or that you have to go into a system to acknowledge and click it. I think that click we would be absolutely fine with. I think the same thing for referrals, discharge instructions, all of that, to me, will be completely teed up and will be able to be sent with voice. If you can imagine, like that ankle sprain, the diagnosis there, you've already picked the ICD-10 code. That ICD-10 code is now made specific with your assistance and AI's assistance. And at the end, it asks you, would you like me to send the ankle sprain document to the person's preferred method of receiving information? Absolutely, thank you so much. I think we're going to see it as more of a conversational partner within the next 12 months. I always joke around, a lot of us will use either ChatGPT or we'll use Claude. I have a tendency to speak to mine. And I do that because, first of all, I can talk faster than I can type. So we'll just start with that conversation. Secondly, the acknowledgement of what I'm saying through AI actually is valuable. And I think in a medical sense, it's going to be incredibly valuable. Like, hey, please tee up a prescription for me for amoxicillin, 500 milligrams, TID, the pharmacy. You use Walgreens? Yep, it's going to be Walgreens on Riverside here in this town. And I want that sent. AI to be like, you didn't tell me how many pills. Like, that is where I think the next phase is going to go.
Absolutely. And as you start to visualize that, you can see how much faster the visits happening and how much faster the things before and after are happening as a result of this technology. So it goes back to what I was saying before, bottom of the first inning in terms of our experience with the technology. But as we train and learn more and get the use cases and the capabilities, I think we'll get faster and faster and faster.
No, I agree.
Got it. All right. And then last thoughts, any suggestions for other people who are in your seat, who realize that there's a lot of opportunity out there, they don't know where to start, they don't know what to do, like what would you recommend to them?
I mean, do what I think we were early adopters of Scribe, right? And I think for some reason people just don't, they think that the cost is going to outweigh the benefit, but they have Dragon. And so I'm always thinking, well, my belief system is do what we did. We talked to all of the AI vendors when we did our RFP. I think that's important. I think it's critical to figure out who is going to be a great partner, but accept the fact that if you're in my shoes and you are not doing this, you will be left behind. Because I do think the patient benefit is also going to be coming in the next 18 months. I think that the next phase is, I think patient portals are cool. I think that they're complicated and a little bit painful. I truly think that an AI company who is able to reach in and answer instead of having a patient portal right on your phone, talking to it, hey, can you please just send me my last cardiology note?
I like that.
Via text. I think that journey is really gonna. I truly think we're gonna be there in 18 months because everything that we're leading up to, it's gonna allow that type of permission and allow our patients to be part of their healthcare in a way that they've never been able to have in the past.
All right, great. Well, I share your optimism. I think pre-pandemic, I would have said 12 months. I don't believe that, but given how quickly things have evolved, I absolutely believe it. And I think that there's so many things that we haven't even thought of that will happen and are made possible by this, and will allow us to be better providers, provide better healthcare, allow people to achieve better health in their daily lives. And I think it's all very exciting. All right. So with that, I'd like to say, Dr. Biernbaum, Rob, thank you very much for joining us today. Again, I am Dr. Jean-Luc Neptune, and this is the Prescribing the Future Podcast. Thanks for joining us today, and we'll see you at the next one.
Thank you.